Welcome to Aging on a Suncoast. I'm your host, Jason Martino. Like previous years, the Medicare open enrollment period started October 15th and will end on December the 7th. This period is a critical time for Medicare beneficiaries to review and understand their Medicare coverage. To help consumers in Pasco and Pinellas counties, the Department of Elder Affairs SHINE program provides unbiased, free, and confidential counseling to assist beneficiaries make independent decisions in order to maximize their Medicare health coverage. On today's show, we've invited back Janet Mills, the SHINE area coordinator, and new to our show is Stan Anderberg, a seasoned SHINE volunteer. Together, these two amazing individuals will shed light on valuable programs that have helped beneficiaries navigate a complex system of healthcare coverage for over 25 years. Janet, welcome back to Aging on a Suncoast.
Thank you.
We're always happy to see you here. And Stan, you're new on our show, so welcome to Aging on a Suncoast.
It's a pleasure to be here, Jason.
Great. So the 2020 Medicare and You books have came out. They came out in roughly around probably the end of September. And very similar to previous years, on the back, it points to the SHINE program in the state of Florida as a trusted source to get help with their Medicare coverage. Janet, what's the mission of SHINE?
The mission of SHINE is to serve and educate in an unbiased and free fashion so that seniors make their own best decisions. It's a national program. It's run through the Department of Elder Affairs in Florida, and we are all participants in that program. There's about 60 of us.
Yeah, 60 strong volunteers that I've known for quite a long time that are extremely educated. And we're also going to talk a little bit about the SMP program, the Senior Medicare Patrol, if I can reduce my acronyms today. A little later in the show, I think we're going to cover that a little bit more comprehensively. Stan, so I'm going to use myself as an example. I am 65 years old. I've been working all my life. I'm thinking about retirement. Matter of fact, I am retired now. And what's the first thing that I need to do when it comes to taking a look at my future with Medicare?
Okay, the first thing I would suggest would be to sign up for Medicare as early as you can. You're allowed to sign up 3 months before your birth month. Mm-hmm. For example, if you were born in April, you could sign up for Medicare in January. And there's different ways of signing up. You can go down to your local Social Security office and sign up there. But there's an easier way to sign up. You go to the Medicare.gov website and you can sign up very easily there. You want to sign up for Part A, you want to sign up for Part B. But if you are already drawing your Social Security benefits, some people draw their Social Security benefits at age 62, then they don't have to go down and sign up at the office or sign up on the internet. Medicare will mail them a card 3 months ahead of their birthday, and the card will include Medicare Part A and B. And then there are also people turning 65 that choose not to retire. They want to keep working. So those people should sign up for Part A, their hospitalization, and not sign up for Part B, and they'll save paying their Part B premium if they are covered by an accredited employee health care plan.
You know, you make great points. We're all very much like snowflakes. It's not just we turn 65 and then that's the age and we start to retire. There's many variations of what we need to think through at that time. And you provided great information on where to start. So Janet, I have Stan help me sign up for Medicare and Social Security, and now it's been pretty close to a year, and the open enrollment period, which we're going to talk about today, is going on. What are the things that I need to think about now that I've already been enrolled in Social Security and Medicare?
Yes, every October 15th through December 7th, for effective January 1st of the next year, it really behooves one to look at what they have in terms of health insurance and review to make sure that they have the best coverage and at the lowest cost. And the SHINE program can help you do that.
Yeah. So we talked a lot about, and I'm going to try to do my best to break down these acronyms, but there's two terms that we hear floated around: the annual enrollment period or the open enrollment period. What exactly is the open enrollment period, Jerry?
The open enrollment period is for people who did not sign up in a timely manner. It is January 1st through March 31st for effective July 1st of that year. That there is that 3-month window every year where if you did not get signed up when you needed to, you can get in that way.
Yeah. And is it important for myself that's already enrolled to keep reviewing my plan on an annual basis, or am I good just to have it for the course of my life?
Absolutely. You want to advocate for yourself every year because things change. The coverage changes, the costs change, the rules change, and there are lots and lots of different options out there.
Yeah. I think when we covered this topic on previous shows, I've used my grandmom as an example. She had, I'll just be benign with it, she's had a healthcare provider providing hers for a long, long time, and I knew very much about the SHINE program. It's a SHIP program on a national level, and in her state, which was Washington State, it was called Shiva over there, I believe. So I would encourage my grandmom many, many times to take a look at her plan and see what was going to be the best for her. And she would simply tell me that she was very comfortable with her plan and that they treated her so well. And eventually she did. She reached out to a counselor and she maximized her savings by doing that. Any examples of someone that has had a plan for a while, chose to review it with any of you two really, and came up with a better plan that was going to meet their needs more holistically?
Absolutely. Yeah. Because of the different changes in the coverage and the cost, if you review based on the plans that your doctors are contracted with and the prescription drugs that you take, you can end up saving thousands of dollars.
Yeah, and that makes a big difference. And
a lot of people don't consider it fun to have to do that. We do. We're here to help. So please call us at SHINE. Yeah. We can help you.
Is it short-term pain equals long-term gain?
That is true.
So Stan, you've been a SHINE volunteer for some time. I'm most impressed with the work you've done, and obviously you've come under the tutelage of Janet when you were first learning these programs. Tell us a little bit about the activities that a SHINE volunteer plays.
Well, if you have problems with your Medicare bills, if you have questions of you don't understand how what the bill is, or you think you've been billed wrong, you can call us. SHINE doesn't pay your Medicare bills, but we will review them with you. We also work with new Medicare people that are new to Medicare. We also screen people for plans that help pay for the prescription medicine. And we also screen people for help that help pay for their Part B premiums. We also have information on preventative medicine, such as mammograms, flu shots, pap smears. And we also can help you with appeals if you have a problem with your appeals. SHINE doesn't have anything to do with determining the outcome of your appeal, but we certainly would be glad to help you. And we work with the Senior Medical Patrol in detecting fraud and abuse. And we also work with the Senior Medical Patrol in reporting that fraud and abuse.
Well, we were talking about wearing different hats a little bit earlier before the show. Excuse me. And it sounds like you're wearing a couple different hats over there as well. Let's go in a little bit more to the Senior Medicare Patrol project on there, because we mentioned it. And can you tell us quickly again the three big factors that it does? Well, detection and...
Yes, it helps with fraud and abuse that is reported. And we always tell people never share your health care information, your card information. There are a couple of really big fraud things that are going around right now. You may have heard of them. You may have gotten phone calls or postcards in the mail, free braces for your knees or your back, and also free genetic testing. And if you hear about those in any way, shape, or form, please call the SHINE program so that we can report that, and your efforts will be rewarded by doing that. Thank you.
Yeah, excellent. And we're going to cover it a little bit later in the second half of the show, a little bit segment-wise. So we talked on about SHINE, and we talked about SHINE on kind of a light level. But what exactly is SHINE, Janet?
Well, the acronym stands for SHINE, is Serving Health Insurance Needs of Elders. And it was a program started by Medicare, actually, about 28 years ago, because there were no Medicare offices at that point. And it is a very individualized counseling, either over the phone or in person. You can make appointments. We have lots of outreach sites throughout Pinellas and Pasco County. And the SHINE 1-800 number can help to facilitate how you can get information on that.
Yeah, and you made a good point about the outreach sites. It's not just the fact that a person can call the Area Agency on Aging, the helpline, and get help over the phone, but they can do it in the community. What types of places is SHINE found in?
What types of places is SHINE found in?
Yeah.
A lot of our counseling sites are in libraries. Some are in senior centers. They are, and you just will be able to find out how you called to make an appointment. All the face-to-face counseling is done by appointment. The phone counseling, we take it on a first-come, first-served basis, and that's done through referred from the helpline for the phone counseling.
Yeah, and I'll make a broad statement about the helpline, that when somebody calls, our helpline is very busy. And a lot of times a consumer wants to be spoken with just that day. And sometimes things don't happen because you guys are having thousands of callers. I think 8,000 people is how many people that you had contact with last year. So for those viewers that are going to call on the SHINE program, be patient. We'll call you back, and we'll make sure that you get your needs met. Stan, you touched on it a little bit as well. SHINE volunteers, they're wearing lots of hats. What type of assistance do they provide? And at the risk of being repetitive, it may be good for our viewers just to hear it again.
Well, we help people select their health care plans. We screen them for programs that will save them money. And we help them with any kind of Medicare problem they have.
Yeah. And what kind of, to be a SHINE volunteer, what types of qualifications do they bring to the table?
Okay, when you first sign up to be a volunteer, you're going to be fingerprinted and have a background check. Mm-hmm. We prefer you to be a full-time Florida resident because this program does run 12 months out of the year. And it would be fitting if you are working full-time already. We don't want you to get burnt out, so I wouldn't recommend this for somebody that's already working full time.
And we're gonna have a we're gonna talk on the second segment about like a call to volunteer, and we're gonna go into some of the technical pieces of that too. But the type of individuals that you work with every day, they all come from different walks of life, right?
Yes, we come from all walks of life. You don't have to have a degree in healthcare or computer science or anything. We come from all walks of life. All you have to have a degree in is compassion and caring.
That's hopefully an easy one for people because they're doing an awesome job. And the types of folks that you're serving, we talked about people calling in. What type of individual calls and needs help?
We help anybody at any age of Medicare. They have to be on Medicare, and they have to be a Medicare beneficiary, but any age of any beneficiary, and we help people that are becoming new to Medicare. They're not quite 65 yet, but they're thinking about getting their health plans, and we do help them out. Yeah.
And also the new to Medicare folks, right? When they have all those good questions to figure out how they're going to...
They're usually inundated. It's a little too much to absorb out of that book.
I feel the same way. Yeah. I get perplexed in this. The 2 ways to get a hold of SHINE?
Okay, you call our helpline, leave a message on our helpline, and our volunteers will get back with you. And also, you can go to the World Wide Web, www.floridashine.org, and leave a message there.
That's awesome. I love that term, World Wide Web, because it's global. And anyone can get on there. And that's a good point. A lot of times that we have mom or dad living over here, and the daughter may live in Massachusetts or Ohio. and those folks can easily come on and look at the website and figure out the information they need from them. Janet, Stan, thank you so much for coming on the show. We're going to have you back on the second half, so stick around a little bit. Please stay with us while we take a short break. As usual, don't forget to have a pen or pencil ready. During the break and at the end of our show, we'll be running contact information for the Aging and Disability Resource Center helpline, as well as the State of Florida SHINE SMP website. When we come back, we'll dive into some beneficial financial assistance programs that can put money back into your pocket and help with the costs of prescriptions.
James is 70 and a writer whose joint pain has been a story in itself. His doctor prescribed a new medication that may not be affordable, even with James's Medicare Part D plan. James called SHINE. SHINE volunteer counselors can guide you to money-saving prescription assistance programs, including a program that helps pay Medicare Part D plan costs for limited-income seniors. SHINE costs nothing but could save you time and money. More information is available at 1-800-963-5337.
Welcome back to Aging on a Suncoast. During the first half of the show, Janet Mills and Stan Anneberg helped us understand how the SHINE program can help Medicare beneficiaries make critical decisions unbiasedly and for free. So let's continue this important discussion and look at additional financial assistance resources that could put money back in your pocket or help with the cost of prescriptions. Janet, welcome back to Aging on a Suncoast.
Thanks.
So glad you stayed. And Stan, welcome back as well.
Thank you, Jason.
So Stan, I'm going to this is not uncommon. We see it a lot with the consumers that live in either Pinellas or Pasco County. I think it's probably a problem around the state. Is a lot of time folks are eligible for different programs that would really essentially put money back into their pocket, but they don't take advantage of it either because there's work involved, or they just don't know that they potentially could be eligible for it. The Supplemental Nutrition Assistance Program, the SNAP program, is a big one in our area, at least, that I know that a lot of people are eligible for, but they just don't seem to either understand that or put the good foot forward for it. But there's two big programs that we're going to talk about that are financial assistance programs. One is the Low Income Subsidy, what we call LIS. And Stan, can you talk a little bit about what LIS is?
Yes, LIS is Low Income Subsidy. It's also called Extra Help. It's through the Social Security Administration. And to qualify, you have to meet certain low income and asset qualifications.
On a broad level, what is the eligibility for the Low Income Subsidy?
It's a pretty low income for a single person or a married couple. It varies between single people and married people, but not everybody qualifies for it.
Yeah.
But it's fun to find somebody that didn't even know about the program and get them signed up for it.
Yeah. I also think it's fair to say that that we may know what the eligibility is now, but we don't want people to screen themselves out.
Right.
We want them to have you all help them understand what that program is and to help them see if they're eligible for that program. Can SHINE help out with the low-income subsidy applications?
Oh, we love to do that for them. We do it from the comfort of their home over the phone. They don't have to come in. They don't have to go anywhere. They don't have to go to an outreach site. We do it right over the phone. I go to the Social Security Administration website on our SHINE computer, and we get it all completed for them, and we mail them the receipt.
Yeah, that sounds pretty easy, right?
Yeah, for people with mobility problems and transportation problems, it works out very good.
Yeah. Now, does the Area Agency on Aging, Department of Elder Affairs, or you determine the eligibility for that
No,
program?
That's a good point to bring up. We don't determine the eligibility, but usually what we do is we don't submit the applications if we know they're not going to get approved.
Right. Yeah, why waste their time?
Yeah, why waste their time?
Right. So Janet, the other big program that we work with is the Medicare Savings Program. Can you tell us a little bit about what that is?
Right. If you are enrolled in some form of Medicare, you can apply to have the state pay your Medicare Part B premium. But that is what is called the Medicare Savings Program. And there are 3 different levels. The higher level, the state will pay your Medicare Part B, and maybe that can also be used as a supplemental insurance. The lower 2 programs pay your Medicare Part B only. And this year, the Medicare Part B is $135. And so that's as really a big savings throughout the year.
It's a massive savings.
It is.
Yeah. And eligibility?
And we do those applications for people, absolutely. And the eligibility, it ranges about something under $1,426 currently for a gross income for a single person, and $1,923 for a married couple. And then there are asset levels that have to be met as well.
Yeah.
But please call.
Yeah.
We can help you do that. And it's nothing against you if you apply and you're not determined to be eligible, but we're here to help.
And why not err on the side of caution and just
Right.
and take a look at it anyway? Similar to the low-income subsidy, does the Area Agency on Aging, you or the Department of Veteran Affairs, determine the eligibility?
No, we do not. The Department of Children and Families determines the eligibility. We are the helper bees.
Yeah,
right.
You're simply helping with the application and getting that through the process for people that maybe don't know how or don't have the ability to. You know, many of our folks do not have the ability to. We touched a little bit on the Senior Medicare Patrol project, the what we call SMP in our work. Can you tell us a little bit about more what that is?
Yes, that's new for us to be included in the SMP program, but it's a very good match because a lot of fraud and abuse and billing errors and billing problems are kind of all in the same realm of things. So to ferret it out, to help with all of it, has been really a good new endeavor. And so any fraud or abuse that you hear about in terms of your Medicare or Medicare Advantage plans, please call us and we will report it downline.
Yeah.
And there have been a lot of success stories in the last 6 months. I think there have been 3 $2 billion plus rings of scam that have been caught.
Yeah.
So the state of Florida is really into reining this in.
And we use the word fraud and abuse. We use that, and it means a lot. But there's also error that occurs as well. And somebody's explanation of benefits, their EOB, sometimes has errors on it too. And you all can help people understand how to look for those errors.
Right.
Yes?
That is correct.
Okay. We talked a little bit about that genetic testing scam. We saw some of that at the local level. We saw some of that at the state level. And then they're making big news about it at the national level. Can you talk a little bit about what that is a way to safeguard some of our consumers?
Yes. There have been some telephone calls related to it. If you can get any numbers or names of persons in the call, please do so, but I would not carry on with a phone call with them. It was first discovered at health fairs. There were people that came, had tables at health fairs, asked for people's Medicare numbers, told them that they could do cancer screening or genetic testing, and then they would have their own doctor in Miami, and Medicare was paying for some of those. Those are $10,000 charges, and they are once in a lifetime allowable testing. So you don't really want to not report it if something like that has happened to you, because you might want that testing down the line in your lifetime, and when it's already been undertaken by scam, then that one time is eliminated.
It sounds very predatory.
Right.
And it's a shame that that would even occur. But like a lot of other scams, they come and they go, and we'll be tackling something new probably within a year or so, or maybe even sooner than that, I hate to say. I'm always impressed with what you all do. You have a core of 60 different comrades that work with you to serve the public. Last year, and at the end of 2018, you took over 8,000 different contacts with very complex types of cases, needing help navigating through Medicare. You were learning the Senior Medicare Patrol project at the very same time you were helping all these different folks. And additionally, you were helping people with the low-income subsidy as well as the Medicare savings program. You're busier than I am. And so I applaud you for all the work that you're doing. But you couldn't do it by yourself. So we're always trying to reach out, and we're always trying to attract volunteers to come help with this because it's a worthy cause. Stan, you touched on it a little bit earlier, and I want to take some time and go through some of the technical things of how to become a SHINE volunteer because it's important and people should know. Tell us a little bit about the qualifications somebody should bring to the table or what would occur if they wanted to be a SHINE volunteer.
Well, they're going to achieve a lot of satisfaction because every day they go home, they're going to find out that they've helped people all day long that they've been there. And they need to bring a lot of commitment. It's a lot of training, and you have to be committed to the training to do the training. And once you do the training, you're not let loose, sink or swim. There's always somebody there to help you. And it's a very satisfying position to have.
We are a team.
Yeah, we are a
and
team.
we've all met a lot of new friends in
yeah.
volunteering there over the years. Yes.
That's awesome. And you touched kind of lightly on the level 2, the background screening. So
Right.
You know, what is that?
All that is fingerprinting, and they check to see if you've had any trouble with the law or anything. So all of our volunteers are good, clean-cut people. And when you talk to the volunteer on the phone, you don't have to be worried about giving out your information because it's all HIPAA certified.
Secure, HIPAA certified, and
secure.
confidential, right?
Exactly.
Right. And the training, as long as I've been working with the both of you, I can never find you because you're either in some kind of a training or you're helping a consumer. Tell us a little bit about the type of training that a volunteer will go through.
Well, it's ongoing training. Anytime there's any changes to Medicare, we know the changes. We're become aware of the changes. We have
Every day we get educated.
Yes, every day we get educated.
Yes, but if you wanted to become a SHINE volunteer, we're interested in finding out more, you can go to floridashine.org, and which is the state website, or you can call the 1-800 number, and then there's a process in the training. You firstly meet with and have an orientation and meet with a manager, and then you have an online training which goes on for a couple of months, and then you have an all-day team training where you meet together, and then you have an exam to pass, and then you have a mentorship where for 3 to 6 months you're working with a seasoned volunteer until you're comfortable, and then you're on your own, except that we all continue to operate as a team and ask each other questions forever, basically.
Yeah, that's a great point, and they'll have the full support of the Area Agency on Aging. Mentoring is the biggest piece, is a big piece in that as well, so they don't have to feel like they're doing all this alone with their newfound knowledge. Janet, thank you so much for coming back to our show, explaining everything that you know, and which is a wealth of information. Stan, thank you for coming on our show and working with Janet on a daily basis and helping out these consumers. Excuse me. Thank you very much.
Thank you.
You're welcome.
We hope you enjoyed this month's broadcast. We also hope that this episode sparked your interest to contact the SHINE program in order to seek help during the open enrollment period. Please remember that this critical period ends December the 7th, so start the process now. We'll see you next month, and until then, please make every attempt to maximize these free and exceptional resources.
James is 70 and a writer whose joint pain has been a story in itself. His doctor prescribed a new medication that may not be affordable, even with James's Medicare Part D plan. James called SHINE. SHINE volunteer counselors can guide you to money-saving prescription assistance programs, including a program that helps pay Medicare Part D plan costs for limited-income seniors. SHINE costs nothing but could save you time and money. More information is available at 1-800-963-5337.